Mental health care is deeply personal, but many patients say their treatment doesn't always feel that way. New survey data from the GeneSight Mental Health Monitor shows many people living with depression or anxiety feel care can be one size fits all and wish that it was more tailored to their individual needs. Today, psychiatric mental health nurse practitioner and owner of Learning to Achieve Wellness, Lillian Ingram, is joining us to talk about why personalized mental health care matters, the challenges of finding the right treatment, and how tools like genetic testing may help inform medication decisions. Thank you for being here.
Thank you.
This is such an important topic today.
Yes.
So really, I want to jump right in with mental health. It looks really different for every single person who is going through it. So why is personalized care such an important piece of that conversation that we're having right now?
Definitely. I think it's just so important that mental health care isn't one size fits all. So GeneSight did a study actually about that, and 88% of people want a customized approach to their mental health care. Just like anything else, they want you to look at their family history, their past experiences, things that they've tried before for their mental health. So just really like digging into all of those components to make a diagnosis and a treatment plan that's customized to them and isn't one size fits all.
Yeah, and it can be kind of frustrating, this, process of trial and error with mental health medication that so many people have to go through. So why is that such a challenge?
Yes, definitely. I mean, even when you look at the study that GeneSight did, so when 13% of people, when they tried their first medication, it failed. So you can understand, like, that's so frustrating. Like, 13% of the time you get it right the first time, and all the other times it doesn't work.
Yeah, that would be hard.
Like, then you're going through these medication trials that can last 4 to 6 weeks, and you really want to try to get it right the first time and minimize side effects, trips to the doctor, and just to feel better right away.
Yeah, which is what they're looking for.
Yeah,
right?
definitely.
So how does GeneSight's test then help inform a treatment decision?
Definitely. So it's a cheek swab. It's ordered by a healthcare professional. You can do it in the comfort of your own home where it's shipped to your home, or you can do it at the doctor's office. Within about a week, you have your test results, and it comes in this great format of green, yellow, or red. And it tells you, based on your genetics, how are you going to metabolize that medication.
Oh, interesting.
So, like, do you need maybe a little bit higher dose than other people, or lower dose, or is that maybe just a medication you need to stay away from?
Okay. The conversations that we have with our doctors are really important. So what do you think those conversations should be had if a patient is feeling this is not working for me? Yeah. What conversation then do they need to have with their provider?
Definitely. They just need to be open and honest. Like, it's so important for us as healthcare providers to know what's going on, coming in and saying, oh, everything's good, because you remember like the last little bit of the day before you walk in there isn't as helpful as maybe taking down some notes, saying, this is how I felt when I was going to the grocery store. I was really anxious at this point in time, and it helps us to make informed decisions. And the GeneSight test definitely guides that, because it helps us with a treatment plan and medication choice. So
what if someone watching this right now, they're having some issues, they're struggling with their mental health? What is your advice? What should they do?
Definitely just reach out. I mean, it's so scary to take that first step, especially like if you're already depressed or you're anxious and it's just too much to even pick up the phone. You can ask a friend for help to call for you. I think the other thing is just knowing, like, I mean, if you had high blood pressure, you're going to go to the doctors and get it treated. Right. So if you don't feel like getting out of bed in the morning, or it's too scary to go into a store and go shopping, like, it's okay to ask for help. You have to do that, because you don't have to feel like that.
Yeah. If people want to learn more about GeneSight and this program and this testing, what's the best way that they can learn more about that?
Definitely. So they can reach out to GeneSight.com. It's an excellent resource. You can even find providers on there that can perform the test. They can link them up to people in their area. We do the GeneSight test at our office at Learning to Achieve Wellness. We have like 14 different locations across Florida, so we're happy to help with that too. Our goal is always to get somebody in like within the first week, because that's the last thing you want to do, is have to wait for help when you want help.
Yeah, well, wonderful. Well, that website is right there on your screen, GeneSight.com. You can go there to learn more. Thank you so much for being here.
Okay.